Good morning. So we continue from where we stopped in our last lecture. Our course of discussion is still PHR 201. Are we together? All right. Today's date is what? 9th, right? 9th May 2023. Good. So where do we stop? Antifungals. What antifungals? What is their spectrum of activity? They act where? What do they do?
They act on the protein membrane.
I ask of their spectrum of activity, not their mechanism of action. Equally, both gram positive and gram negative. Are you sure? Example. Good. So we continue from where? We continue from where? Streptogramins. Streptogramins. We continue from streptogramins. Now, like antifungals, streptogramins also attack the what? Bacterial protein what? Synthesis. Am I communicating? They also take care of the what? Bacterial what? Protein what? Synthesis. That means they are generally what? Bacterial what? Statics. They are generally what? Bacteriostatics. Good. And their spectrum of activity is mainly what? Gram-positive species. That's their spectrum of activity. Is there any other class, group that attack just gram-positive we mentioned? Is there any other group from what we discussed? Is there another group from what we discussed that attack mainly gram-positive? I told you to study this comparatively. Try to find out which area, I said, is there any one that is only gram-positive? Is there another group like that? Are you sure? Check well. No, right? Are you sure? I mean, from the ones we've done, no. So please, these things are very important. Check well. These streptogramins are mainly what? Are only what? Gram-positive what? Species. Are we clear? Gram-positive what? Species. So their spectrum of activity are what? Gram-positive. Lincosamides attack gram-positive and the anaerobes. Am I communicating? And the anaerobes. But streptogramins focus on what? Gram-positive species. Gram-positive what? Species. All right. Now, examples we can find under this. So, you will spell as I write it down. I have spelled. We what? Again? We know what? We know spretin and what? And what? This is Dalfo, not Dalfa, sorry. Dalfo what? Dalfo what? Dalfoprestane. Quinoprestane and dalfoprestane. Quinoprestane and dalfo. It's not dalfo. Dalfoprestane. These are examples of what? Antibacterial under what? Streptogramins. Strepto what? Gramins. Quinu and what? Sulfospretine. Men, their activity is on what? Gram-positive species. Bacterial nucleic acid, or is it nucleic acid of protein synthesis? Protein synthesis. That's where they attack. Am I communicating? They are bacterial what? Generally bacterial what? Statics. Are we there? Are we there?
Yes.
Good. Now, another group I want us to look at is steroid what? Steroidal. Are we there? Come in. Steroidal. Steroid what? That. They also attack bacterial what? Protein what? Synthesis. Remember I told you that I want you to find out on your own. There are some of them that take care of 30 what? Where does protein synthesis take place in the cell? Where? Cell membrane is not true. Where?
Okay.
Ribosome, good. Ribosome, good. What is the difference between smooth endoplasmic reticulum and rough endoplasmic reticulum? What difference? Where? Rough, right? Good. Now, I want you to find out which part of, we have 30S and 50S subunits. I told you this in our last lecture. I want you to find it out on your own. Each of these things we will be talking about protein status on ribosome. Where is it 30 what S subunit or what 50S? Am I communicating? Find out. I told you something that I said that they attack protein synthesis. All of them inhibit the protein synthesis. So where exactly on the ribosome do they attack? Am I communicating? Is it on the 50S or what? We have 50S subunit. Haven't you heard of it before?
No.
Are you serious?
Yes.
Wow. Come in. All right. So Google it now. Am I communicating? Which you can take making of action of any of them. Am I communicating? And they find out actually. You can Google it. They go deeply into which is it 30S or what? 50S. Am I communicating? No, we say generally protein, but all of them, are they actually focusing on the same area, or are there those that target what 50S subunit and or 30S subunit? Find out the one which of them. That's why it's an assignment. Find it out, even though you are not submitting it. I want you to do what? Find it out. It will encourage your what? Studies. Are we communicating? Do it yourself. You appreciate what we've been doing. Okay? Are we together? Do it. Find out which of them. All those antibacterial we've been mentioning since that attack protein stasis. Where specifically do they do what? Attack. That's what I want to find out. I want to find out. I've asked you about ribosome now. Where protein stasis take place. You say what? Ribosome, right? Inside that ribosome, we have 30S and 50S. Which of them is on 30S and which of them is on 50S? We've been mentioning all of them. Almost up to 5 or 6, right? So find out on your own which of them. It's simple. Each of them you pick. Find out mechanism of action of that drug. You mention it. It will tell you specifically where it takes place. Am I communicating? You can even do it in here and now and tell us the what answer. But let's continue because I don't want us to waste time. Remember I told you I don't want to start going deep into this. If I say I'll remain on one class, lecture will finish. And the end, you're not able to do what? Comment. That's why we are offering discuss only this semester. We want what we this semester too. There's no we that even me as a pharmacist. I spent almost 3 years or more in school studying pharmacology. I didn't cover everything in pharmacology. Now you only one semester. It's not possible now. So the best thing to do was touch them. The most area you need. I'm not communicating. not going deep into these things, but just I'm throwing it to you so that you know. You can find out on your own and expand your what? Knowledge. That's why I don't want to go into all those things. Am I communicating? Good. Now, steroids. Under steroids are also, they are also what? They also attack what? Bacterial what? Protein what? Synthesis. They also attack what? Bacterial what? Protein synthesis. Am I communicating? Now, under these steroids, their spectrum, what I mentioned is making of what? Action. Am I communicating? Making of what? Action. If I were, although I didn't tell you for the beginning, how to write that into, just simply say, the one you mentioned is the MOA. Bacterial protein what? Synthesis. Inhibition of bacterial what? Prosthesis. Is there SOA? Either gram positive or gram negative. Am I communicating? Now, another one is what? Another one is what? Maybe, is there example? This the example. You have given me what I need in this particular what group. Am I communicating? SOA means making of action. Spectrum of what? Activity. Examples of them. Is it clear? I'm just giving you a clue to put down your notes so you don't keep telling long stories and the time will pass, okay? Yeah, but if you are good at telling long stories and at the same time meet up with what about me, it's okay. And what I told you, the best way in my class is to just put on your phone, try to do what record, so that at the end you can actually go through them and make up your notes. Is it clear? That's the best way. Now let's continue. Now, an example here is what? We are the one we call, the example here is what? Okay, sorry. Spectrum of what? Activity. They generally, of course, they have narrow because they are also gram positive. Am I correcting? Just like we have a streptogramins, they are also what? Gram positive species. Are we there? They attack gram positive what? Species. So an antibacterial that attack just maybe gram positive or gram negative alone, and the one that attack both gram positive and gram negative anaerobes, which of them has wide spectrum of activity or broad? Which of them? Both, every, right? Good. Why one attack just one? Maybe one group of a species has what? Narrow what? So that means streptogramins and steroids, they have narrow what? Spectrum of what? Activity. A question may be, which of these antibacterials have narrow spectrum of activity? So first of all, you should even know what the activity looks like before you can think of whether you understand what is even narrow spectrum before you now pick your what options. Are we there? Good. Because this nature of this question, this exam will be OBJ. Take it or leave it. Am I communicating? Because there are a lot of things to do what? Talk about. Are we there? My question. Now let's continue. Example here is what? Fusidic what? Fusidic what? Acid. Fusidic what? Acid. That's a typical example here. Fusidic what? Acid. Fusidic what? Acid. So without wasting time, let's go to the next group. Quinolones. You can search for other this thing. Quinolones. You are familiar with this one, but you may not know. Quinolones. That's what. Give me an example here. Example. Let me know those that study ahead of us. Example. You can could. Or is it? Is it not a queen? Is it okay? Is it not a queen there? It means someone that doesn't go to class may go. Maybe you give me the options I'll put here. Quinine. Option B, quinine. Option C, chloroquine. Who's other two? We are like whatever. Thank you for giving me also that will give you. Hey, thank you. She said chloroquine. More options are coming. Yeah? Don't worry. Let's continue. We'll talk about it now. Now, quinolones. Now, see where they attack. They attack bacterial DNA synthesis. They attack what? Bacterial DNA. In fact, everything they attack is of DNA. Both the synthesis, DNA, and replication. Am I talking? Coming. They attack bacteria. See what they attack there. Bacteria what? DNA. They may attack the synthesis. Focus on the what? Synthesis. Even what? The structure. And what? Replication. I don't want to start going into deeply. There's what we call DNA gyrase. There's an enzyme. That one is going straight deeper into all these things, which we take our time. Am I getting? Just know that they focus on DNA. If you start going deeply, what do they do to DNA? There's an enzyme they focus DNA gyrase. I don't want to go there. I'm getting. You can browse that on your own and study. But just know that their focus is on what? DNA what? Bacterial DNA synthesis, structures, on target replication, structures, synthesis. That's where their area of what? Specialization. Am I communicating? Good. Why I group it like this? There are other groups that also target this. Are we together? Not only what? Quinolones. It's not left for you to take which of them, focus on each of these. Am I communicating? Do that. Now, I want you to understand something. What of their spectrum of activity? They are what? Gram what? Who said that? Can they put that thing? They focus both, they attack both what? Gram negative and what? Gram positive species. Are we there? They attack both what? Gram positive and gram negative what? Species. Both gram positive and what? Gram negative species. Those that are smart, as I'm talking about those areas, I say I don't want to start going deeply because if I enter there, we will not finish this course before you write the exam. I mentioned DNA gyrase. Some people that are smart will go on their own to look for what is called what? DNA what? Gyrase, and see how far. As you have spare time, develop yourself, look at DNA gyrase. What is DNA gyrase? Which antibiotic or antibacterial actually attack this? Because tomorrow you don't know where you see yourself tomorrow. Tomorrow you may even decide to even gyration now. From gyration. Gyrase. Now let's continue, please. Let me not waste time there. As I say, maybe what I'm through with everything I need to introduce you to. Time, if there's still time, we can now pick them, start talking about pharmacology as in going deeply, but I don't want to waste my time there because it may affect it. Are we there? Please understand what I'm doing. This is more of introduction, introducing you in every aspect you need to know, without going deeply into them. Because if they actually want us to go deeply, you would have done it from phase A to friend. 3 of us, first semester, second semester. But it's not like that. Unlike pharmacists that do it from where? Even from, they keep doing it till they graduate. These are what you help you to know exactly the course you actually need as a serious aspect of your practice. Not that you don't need this, but not so. Now, examples of them. We have examples. We have ciprofloxacin. We have what? Yeah, we have familiar with this one, right? What do you use it to treat? Good. We have what? We have what? levofloxacin. We have moxifloxacin. Moxifloxacin. We have nalidixic acid. We have nalidixic acid. We have nalidixic acid. We have norfloxacin. Norfloxacin. We have norfloxacin and we have ofloxacin. Ofloxacin. So we have ofloxacin, norfloxacin, ciprofloxacin, levofloxacin, moxifloxacin, and nalidixic acid. The one that's the most popular in this part of the world is what? Ciprofloxacin, levofloxacin, and what? Ofloxacin. Yeah. We see this one is there, but these are the most popular. And in the order of popularity, we have what? Ciprofloxacin, followed by what? Followed by what? Levo. You are there. You are there. You are there. So these are what we call quinolones. Some call it fluoroquinolones, but just know that they are what? Quinolones. Are we there? So it's not quinine. It's not chloroquine. It's not primaquine. It's not what is it called again? What is it called again? It's not piperaquine. Forget all those ones. Those ones are anti-what? Malaria. Those ones are anti-what? Malaria. Now let's continue. We have the one we call macrocyclics. Macro what? Cyclics. Macrocyclics. 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 Macro what? Cyclics. Now, they also focus on anything that has to do with bacterial what? DNA. Am I communicating? Bacterial what? DNA. That they attack bacterial what? DNA. Can be their synthesis, can be their structure, even their what? Replication. So if I were, what I would do is this. Since I've been calling those that are on my own, that's how to understand something. On my own, try to find out, is it quinolones that attack replication? Is it this one that attacks synthesis? Am I communicating? These are what your Google can help you do what? Achieve. Am I communicating? Within a twinkle of an eye, you do that, make up your note and now macrocyclics. Sorry. So that means, do you think quinolones are bacteriostatic or bacterial? Bacteria. They're generally what? Bacterial what? Something. Am I communicating? They're generally what? Bacterial what? Something. Generally, even though there may be some, but they're generally what? Bacterial what? Something. Now let's continue. So these ones, they also attack distance. DNA is DNA. They focus on what? DNA. Now, this one focus on the fact they have more do I use affinity or more reactivity or more action towards Clostridium. Have you heard of the bacterial Clostridium species? Yes. Clostridium. We have this one. They act more on Clostridium what? Clostridium difficile. Clostridium difficile. You know, most of these things are from Latin word. Am I communicating? So you don't pronounce them. You don't prepare them like English word. Most of these scientific names. We have Clostridium what? Clostridium what? Diffi what? Is it difficile or difficile? Difficile. Do not say ichi. Difficile. Clostridium difficile. That's where their area of what? Specialization. So they are used to treat what? They are used to treat Clostridium difficile infection. Clostridium difficile what? That means the Clostridium difficile bow to what? To them. Am I communicating? This group. Macro what? You know, these things are what will help a clinician to know the choice of antibacterial on a particular what? Infection. Maybe you have an infection. Someone, after the scientific test, the person's presence of this thing is detected. If I am the clinician, if I am the clinician, I would look for this, what is called this macrocytic, because for them to be focused on that means they actually deals with it without mercy. Am I competing? I'll look for them unless they are not available. I can now look for that one that can do what? Do the job. But this is my first line of what? First line drugs. Is it clear? So now under this macrocytic, that we have what? I spell it. Spell it. Feeder what? Clostridium which is it positive or negative? Clostridium. You're supposed to know this thing. Who alone? What? They have blood system. You should know with this thing. This is your area. Why you should even know it more than I do. Yes. Yes. You should know it more than I do. So find out. I won't tell you. Find out. You find out tomorrow. You tell us, or on Thursday you tell us. Are we together? Find out and tell us. So feeder what? Feeder what? Moxicillin. Feeder what? Moxicillin. Now, another group I want to talk about is this. Another group I want to talk about is this. Fidamoxicillin is what? Where does it belong to? Check, what did I say? Forgive me. Did I say fidamoxicillin? What am I writing? The brain is firing. The brain is firing. No. Hey. Please, cancel, please. Fidazomycin. Or mycin. No, not mycin, mycin. Fida what? Fidazo, not fidamo. Fidazomycin. Fidazomycin, not fidamo. The same. Fida what? How are you? Fida what? I've confused some people. Fidazomycin, not fidamoxicillin, please. Fidazomycin, please. Please, I beg you, please. Fidazomycin, please. Okay? All right. Now, there's another group I want to talk about. This group are called what? Answer what? Answer what? Answer my sins. Good. Answer what? My sins. 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 So this answer my sins, they also focus on what? Bacterial what? DNA. Are we there? Are we there? See, if you want to remember making of actions, try to find out for which part of bacteria do. You know, we mentioned about all these things with different things that are grouped into three places. We have bacterial cell wall, right? And membrane, right? Those that focus on bacterial cell wall and membrane, right? We have those that focus on bacterial protein synthesis, right? In group. Then we have those that focus on bacterial DNA. There are some things we just tell you nucleic acid. Some we use nucleic acid. Is there another nucleic acid? But this one is trying to tell you exactly where it's at. But this some tell you bacterial nucleic acid synthesis. There are some that are mainly nucleic acid synthesis. Remember I told you these things can be their structure, can be their synthesis, can be their what? Replication. I don't want to start breaking them down. I want to do it yourself. Are we there? That's why I said that there are this group, some target on synthesis, some target on what? Structure, some target on what? There are some, if you go to some things we space with, they tell you DNA, bacteria, nucleic acid synthesis. Some tell you DNA replication. So just focus on the what? The structure. Each of these things. For you to cement well, I want you to, on your own, try to find out which of these two ones listed. This is the assignment I want you to do. Are we together? Find out on your own. Yes, sir. If I come back in our next class, I will ask it as a question. You saying it, I will listen to it. I'm not forgetting. I will just ask it one question, two questions, and then I will go. I will see whether you've done it. Are we together? So find out. Do it. Separate it yourself. Let it be what you contributed to this lecture. And that's when you understand this better. Okay? I've given you a clue. So go here into the word of Google and do what? Multiply. All right. Okay. Now we have this one. This answer my sins. They are also on this. Are we together? They also work on this. Now, another thing I want you to know is this. Have you heard of the disease called traveler's disease? Traveler's disease. What causes traveler's? Okay, you don't heard of it. Traveler's disease. Specifically, we call it what? Traveler's what? Diarrhea. Have you heard of traveler diarrhea? Traveler diarrhea? Okay, someone should Google travelers diarrhea for us. Fast. Someone should, let's go a bit franker now. Someone should Google travelers diarrhea for us. Just one minute. As what?
Jet lag.
Jet lag is what?
That's what they used to call it too.
Jet lag.
That's what I used to hear.
Spell it. Let me know what you're saying.
Jet.
Lag. Jet lag. I've heard of this term before. We learn every day anyway. Let's browse this. What is traveler's diarrhea? Fast. What is it? Is what? Traveler disease. Traveler diarrhea. Is what?
Digestive tract disorder that commonly causes loss to an abdominal cramps. It is caused by eating contaminated food, drinks, and
with what?
contaminated water.
What causes it?
By eating contaminated food. Bacteria.
Which bacteria? Did they mention the bacteria? Your target should be the bacteria. Example, the bacteria that causes it. That should be your focus. It's a diarrhea, we know. We know what diarrhea now. It's true of us. Lose two, but there's a particular bacteria. Is here food poisoning? Wonderful. Is there any bacteria mentioned there?
Yes, sir.
That should be your focus. Not long story. This is how to check information. Focus on the causative agent. Am I communicating? Yes, we describe it. We know it's a diarrhea. Yeah, we know. Loose stool is involved. We know. It's not again anything. But the point is this: which bacteria? Yes, food poison. Most food poison are caused by what bacteria? Not the poison we give to people give to each other. E. coli, right? Is it gram positive or gram negative? Gram negative. Is it gram positive or gram negative? No. So if these antimacin are used to treat travelers' diarrhea, do you think they have activities for the ascorbyl activity has effect on gram-negative species? Do you think? If you say that E. coli is gram-negative and E. coli is implicated in travelers' what? Diarrhea. And the antimacins are used in treatment of what? Travelers' diarrhea. So that means, can you now say that antimacin also have activity on what? Gram-negative. Can we say that? We call it logic, right? Can we say that? Come in. You know, there are each of these things have a particular area they are used mainly. So travelers what? Diarrhea is caused by what? E. coli. Have you now seen, if you know how to get the right information, there's somebody you give this as a now you go and sit down and be telling long stories. If you after telling these long stories, you will not be able to even hit the point. But you can sit down and get a point. Lose to diarrhea, lose to caused by GIT, gastrointestinal what? Disease, lose to caused by what? E what? Coli, food poisoning from what? E what? Coli. You have hit the point and you get your full mark. An example here is what? Is what? Refer what? See. Refer me what? Refer the what? Thank you. Careful. Okay, reformycin. Okay. Is the first one. Good. This one is also one of them. Refer what? Refer the what? Refer the what? Refer the what? Refer the what? There are many of them you can search, okay? Let's not waste our time there. Now let's look at this last group in this. Okay, not the last group, sure. Second to the last group. After that, we enter into other things. What's time? We still have time. No, we don't have time. Okay, I'll go by 9. All right, let's continue. Now you have nitroimidazoles. Nitro what? Nitroimidazoles. Nitroimidazoles. I thought this your partner is in this class. Huh? Get up here. Nitroimidazoles. 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 Their effect is still where? Here. Find out which one they do. Are we there? Is localized, say, nucleic acid. Find out whether it is synthesis, the structure, or what? Replication. Am I communicating? This is I'm telling you, This I'm telling you will help you to understand this better, okay? If I start picking them one after the other, sorry, I will not end today. Let me keep going. Just find out, just so that they are localized here. Can be synthesis, can be structure. Find out which of these. I'm giving you an instance. I told you I mentioned DNA diary for what? So let's continue. Now here, these nitroimidazoles, they are used to treat specifically, just like we have in, just as we have in macrocyclics. They're also used to treat Clostridium difficile infection. Clostridium what? Difficile what? Infection. Clostridium what? Difficile infection. The smart ones are firstly looking at this number, writing it as the horse without wasting time. Makanaga aya question. Makanaga imagine. Aga aya question. But don't be afraid of what. Once you do the right thing, you will scatter everything. Yes. Once you do the right thing, do what? Even if the question is up, even if the question is up to 200, you do what? You scatter it. Three of us. It's true. Do the right thing, and you succeed. Just listen to what you are told to do and do it simple. Just once you listen and follow. Your IQ is not enough. You must learn how to do what? Listen and follow skills. Is it clear? Now, Clostridium what? Difficile another infection, chlamydial infections and what have you. Are we there? Other what? Infections. Now, there are also infections caused by anaerobes. Also, these groups also to tackle it. Caused by what? Flavor. Yes. Anaerobe caused by what? Anaerobes. Are we there? That's why I don't know. I don't want to go into, but I think I need to mention it. That's why there are some. In fact, there are some. Most of these antibiotics and most of these, not just antibiotics, antifungal used in treatment of maybe vaginal infections and everything. All these candidiasis and all. You see them. If you have an opportunity to look at them, there are some of them that will contain these nitroimidazoles. Example of nitroimidazole, we have metronidazole and we have phenidazole. That's why most of these insertions, they like to include. They may have antifungal there. They also include this metronidazole or phenidazole there because of this other infection caused by what? Anaerobes. Am I communicating? That's why they add it.
So what about
ketoconazole? Ketoconazole is antifungal. We'll still talk about antifungal. It's not. That's why you should be careful. If you think they think the same thing. In PHR option, which of these things are nitroimidazole, ketoconazole? In all the zones, wujiolugi, ebayalabazia, metronidazole, ketoconazole, all the zones. Your eyes are very because you are not in class, and you didn't bother to listen to the lectures recorded by your classroom, your classmates. You think you are all giant, all super IQ. 10/100. So please, you need to listen and follow. Thank you for asking that question. Ketoconazole is what? Antifungal. Even though it has zo behind it, it's not under this. Am I communicating? Under this, we have, someone also talked about clotrimazole. It's also antifungal. It's also under this. Thank you for giving me more options I will give you. Clotrimazole, ketoconazole, be bringing all the zones, okay? Albendazole, good. Albendazole is not even antifungal. It's not antibacterial. It is what? Anti-helminthics. Thank you. Get up for albendazole. God bless you. Now here now we have what? Oh, thank you very much. No, but if I put omeprazole, it will be okay. Because omeprazole is common, anti-auto. No, I won't put that one. Now we have here what? Metronidazole. Metronidazole. We have what? This brand name is here is what? We have flagell, right? Then we have tinidazole. We also have onidazole is also there. Onidazole is also here. We also, even secnidazole is also here. Secni what? Nidazole. These things are just modifications of this. Am I communicating? Yeah, but the most popular one is what? Metronidazole. So these are what? Nitro what? Imidazole. Nitro what? Imidazoles. They are bacterial what? But they're generally what? Bacterial what? Find out. Sorry, my dear. Now, there's the last group I want to talk about. These ones are, in fact, when it comes to in treatment, even in hospital, most urinary tract infection, API this group or deluge. Most urinary tract infection, this group is made now because they are final what? Bust off. Although they are rarely used, but they are very effective. Now, we have the one we call nitrofurans. Nitro what? Furans. Nitrofurans. Nitro what? Furans. Nitrofurans. Now, this nitrofurans, they also focus on what? Bacterial what? DNA. Find out where they focus on. Am I communicating? Find out. Do it yourself. It will help you to grow. Now, so they are basically focused on urinary tract infections caused by what? Gram-negative species. Are we there? Urinary tract infections caused by gram-negative what? Species. Urinary tract infections caused by what? Gram-negative what? Species. And a typical example there is nitrofurantoin. Nitrofurantoin. Nitro what? Furantoin. Nitrofurantoin. 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 I think at this junction we move to the next group of anti-infectives. We move to the next group of what? Have you seen? Just mention their name and say one of it. Took us how many periods? How many periods? Almost three periods. Eh? Just to mention their name, their classes, so not to talk of trying to explain them. Took us how many ones? That's like when they said I will teach pharmacology under one semester, I started laughing to myself. How will I compress this whole thing? What will I even teach? What will I even cover under one semester? So that's why I'm trying to. You work together. There are some you go and check up on your own. Those are deep things. I will just touch them so that you'll be able to touch as many as possible. So that by the time we are through with this course, believe you me, by the time we are through with this course, with the system I'm using, by the time we are through, by God's grace, there's nothing they will mention you won't even have idea of what it's all about. There's nothing they will mention in pharmacology you won't have an idea, even though you may not know it deeply as those in the area. But there's nothing they will mention you won't have an answer. At least you will know, okay, this one is this, okay. At least you can relate with your healthcare what team. You can relate with them when drugs is talking about, when they talk about what. So that's the idea. So that not when If there are some things they maybe say, look at it, doctor, are you saying? What are you saying? No, doctor, this is the Queen alone. Queen, look at this. Doctor, I thought the American lab detection. How come you know Queen alone? But they may not expect that you, even with mastery, you may know at least to this level. But know it, apart from that, it will help you personally and otherwise. Now let's go. Remember, I listed 3 words. If there is time, I seriously I want to cover, but let me outline them. Even if you are not able, you can lead it up. We have anti-what? Anti-what? Bacteria / what? Anti-what? Antibiotics. We are done with this one, right? We have anti-what? Anti-what? Fungus, right? We have anti-what? Virus. We have anti-protozoas, right? We have anti-protozoa. I don't know why we don't have, brother. We only have anti up and down. We have anti-what? I think I didn't mention this. Anti-what? Helmintics. And if you're able to cover this thing, you know them, at least know their class, know each, at least an example of each of them. Have you not seen how some people we are mentioning, because they heard zoo, they said talking about ketoconazole, which is supposed to be antifungal. At least you should know which one is which, that this is antifungal, this is antibacterial, this is anti-malaria. Is it clear? When I mention quinine, some started mentioning anti-malaria for me. Quinine, chloroquine, pipera. Are we there? You know, it can be embarrassing that even though yes, it's not here, but at least there's this confidence you have that at least you know these things. Even though you are a medical lab technician, sometimes you may see yourself in an interview. A question may be asked. At least you as you are discussing, you can mention one or two things. It's 2 of us to help you to grow. Now let's continue. So we have. Now let's look at anti-what? Fungi. I will not go. I will not treat this. I will just mention them. Are we there? You know, this took us time. Okay, but I know why I took time, because here are our trouble, and there are many of them. That's why there are many of them. I can go. So that's why I took time to talk about go a bit deep to talk about their classes. But it may not be like that with other ones. I may just talk about the examples and what they treat, and we go. Are we together? Good. See what I will do. Hello? I will use, there's a system I will use. Am I communicating? Then if I use it, I want you, at least I've told you some things about actions. Are we there? Making of what? Actions. 2 of us. So what I'll do is this. I'm looking for a means that will help us to be fast here. So what I will do, 2 of us will do this work together. What I will do is this. I will introduce some aspects. I want you to check up some things. I'm on your own. Are we there? You add it. What I will do is this. I'll talk about the type of fungi. Am I communicating? The nature of fungi. Then talk about what they can cause. Are we there? Then talk about the common drugs. Are we together? That you can use to treat. So I want you to do 2 things. Those drugs I will list, even though they are categorized together, but I want you to find out on your own. Those drugs I will list. Try to find out 2 things for me. Is there in Google? Try to find out 2 things for me. find out the class they belong. Are we there? Are we there? Then find out their distance. Just these two things. You find out. Okay? Okay? Find out. Just find out the class they belong and their MOA. Simple. I will just mention these categories, the type of, the nature of fungi, and what the Are we together? Are we together? Hello, are we together? Okay. So what as I said, I will just mention, I'll mention the groups of organisms. Am I completing? Fungi. Then I'll mention the principal organisms that cause a particular disease. Mention the disease. Then I'll mention the antifungals that can take care of those diseases. So just look at those antifungals I'll mention. Find out where they belong to. The group, the class they belong to. Then find out their makers of what? Action. So and blend the two of them and we move. Okay? If we do that, we can finish this aspect even today. Then tomorrow again we enter another one. Okay? So we can finish off on time. I don't want to spend so much time the way I did here. Now let's go. Now, of course, from here you did mycology, right? You did mycology, right? Well, what is mycology? Good. So what do you feel that is? If you did bacteriology, that means you should do what? Mycology. Virology, oh yeah. They may not write mycology on the board. Some write to, but they should know what mycology is. Okay? Good. Now we have yeast. I'll list them, the different groups. Then we'll take it up like that. In antibacterial, I did it drug related. I want to go from disease now to end with drug. Are we there? So try to follow up so you can appreciate what we are doing. I think this will help us be faster. This will help us to be what? Faster. I'm employing every means that will make it to cover this thing. Now, next one is we have your what? Yeast. Are we together? We have yeast. Are they fungi? Good. Then we have yeast. You see a fungi that looks like what? Yeast. We call them what? Yeast like what? Are we there? Are we there? Yes, sir. Then we have filamentous. Filamentous what? Filamentous what? Fungi. Then we have diworts. Diworts. Can this now be fungi? Diworts. Good. Dimorphic. So, let's focus on this for now. There are many of them. This thing is not a deep thing. Just try to find out more. Let me work on this, okay? We have the yeast-like fungi. We have filamentous fungi. We have dimorphic. Now, let's pick examples of each of them. Under the yeast, come in. The culprit that causes issue there, a typical example that causes issue there, we have the one we call Cryptococcus neoformans. Cryptococcus what? Neoformans. Crypto what? Crypto what? Crypto what? Neo what? Cryptococcus neo what? Formans. If you don't see my handwriting, please let me know. Don't write what you don't know. Cryptococcus what? Neo formans. Yes. The organism that gives a very important issue there. Cryptococcus what? Neoformans. Principal disease it causes here is what? Meningitis. principal disease it causes is what? Meningitis. Meningitis. So not only bacteria causes meningitis. Okay. Let me not go far. What? Meninges. Meninges, right? So what is meningitis? Of what? Good. Meningitis. Mening what? Gitis. Mening what? Gitis. Mening what? Gitis. Now, antifungals used here. We have, remember I told you, after listing them, try to find out their class, group them on your own. Do it. I want you to do it. Do it. Then try to find their mechanism of what. How do they carry out this action? Are we there? We have amphotericin. Amphotericin is used here. Then we have flucytosine. Then we have fluconazole. You are familiar with fluconazole, right? Right? So we have amphotericin, this is R. We have flucytosine and what? Fluconazole. Flucytosine, amphotericin, and what? Fluconazole. Flucytosine, amphotericin, and fluconazole. Remember, find out their MOA and their classes. That's how they are classified. I don't want to start spending time on classes of antifungal. So I want to spoil you. I want to, actually let me encounter something that you can go and do what. Now, let's pick it's like. Here we have Candida what? Candida what? Albicans. Candida what? Candida what? Candida what? Candida what? Good. You're familiar with this one now, right? Candida what? Albicans. This is organism response. This is the what? One organism there that we have Candida what? Albicans. Now, what are the principal diseases this can cause? You are familiar with this. It can cause. Good. It can be localized. It can be systemic. True of us. It can be localized. It can be what? Systemic. It can be localized. It can be what? Synthetic. Systemic, not synthetic, please. Now we have thrush. Have you heard of the term thrush? There are some people that if you look at their mouth, even there are some children, maybe if you look at their mouth, you see white thing, and it's painful to them. Even some adults, you see that some HIV patients also have it. Even some normal also develop thrush. I'm not communicating. If you look at down in the tooth, about the do. As you go down, you see white tissue deposit there. I'm not communicating. This is what? Thrush. Oral thrush. It can be oral thrush. It can be oral thrush. It can be oropharyngeal. Of course, you know when you say oral is on the buccal wall, cavity, right? But if you say oropharyngeal, it's going down to what? Pharynx. True of us? Good. Now, what is it?
So I thought this candidiasis one, which mom that this antifungal is. Oh no, like
Yes.
We
are talking about. We are done with yeast governor. We're talking, even though they call it yeast up and down, but it's actually yeast-like. Is it clear? It's only yeast-like we have what Candida what albicans, please. Okay. Good. Now, that thrush. You don't understand what a thrush is. It's actually a fungal infection. Okay. It's actually a fungal what? Infection. So it can cause thrush, or other superficial infections. Here we use now we use fluconazole. We use what? Fluconazole. We also use itraconazole. Fluconazole, itraconazole. Are we there? Fluconazole, itrawhat, ITR. Do I have to clean this board so someone will not go and start writing Nigeria? No, well, let me clean. Where is this thing? Care body. Thank you. Let me clean it so I don't confuse it with antibacterial. We are done with antibacterial, so let me clean up. It's fluconazole. Fluconazole. Any issue there? Any mistake there? ITRA. ITRA. Then conazole. ITRA. Or ITRA, anyone. ITR, then conazole. ITR, then conazole. Then this particular candida albicans can cause systemic candidiasis. It can cause what? Systemic. I'm talking about thrush, right? Remember, I say candida what? Candida what? Albi what? Can. I talked about thrush, right? Another superficial what? Superficial what? Infection. I talked about what? Fluconazole, right? And what? Itrawhat, conazole. Are we there? You cannot see it, right? Don't worry, let me. I say thrush and other superficial infections. Thrush and the other superficial what? Fungal infection. Am I communicating? Then the same thing can also cause what? Systemic what? Systemic what? Now, if I say superficial, there are fungal infections that you see on the skin. Is skin not superficial? True of us, there are fungal infections you see on the skin. Are we together? Even on the fingernail. True of us, this is a superficial fungal infection. I say that was a thrush and other superficial what? Infections. Now, it also causes what? Systemic what? Systemic what? Candidiasis. Vaginal infection. Is it superficial or systemic or inside? Is it superficial? It's localized. It's outside now. It's outside the body. It's not. Vaginal candidiasis. Is it systemic or localized? Superficial. It's localized. Is that particular? That's why they use cream to rub that place. It's not true. Why? Watch out, you don't know what I'm talking about. Why? You know. You know. Don't pretend you know. It's not true. You don't know. Okay, sorry. It's not your line. Sorry. Okay, so nobody has treated you this thing you call third infection here. So what you call third infection is nothing but vaginal what? Candidiasis. Candidiasis, simple. Am I communicating? Caused by this. It's not systemic. It's localized. When you say that something is localized, it's like what happened to you on the skin is localized. Except the one that is systemic that manifests on the skin. There's one that will be systemic and manifest on the skin. That's why sometimes if you apply the cream, you notice that it's not going. You have to stick so that it will attack it from what? Inside. But there are some you just rub the antifungal cream, it will just clear. There are some if you rub it, it will clear, more will come out again. Know that there are something else, you need to tackle it from what? Inside. I'm sorry sorry, sometimes I used to, once I start talking now, I forgot that, I forget that I'm dealing with medical lab technician. Don't mind me, sorry. Now, but at least it's good you know this, for your own sake. Now, systemic is more systemic inside the body. Am I communicating? That's why you have thrush. Thrush is also localized on it. Thrush is localized. That's why sometimes some patients may you just use nystatin oral drop, put it that place, and you take care of it. Sometimes they will just use nystatin. Sometimes they use nystatin insert and put in the vagina. It's not going inside the body, just there to take care of it there. That's why it's what localized. It is superficial. Thrush is and other superficial what? Infection. That's why I'm trying to explain to you what I mean by thrush and other superficial what. So when they mention that other, you start talking about both on the skin, vagina, and other things. So far they are what? Localized. In other words, you can simply say localized and systemic. You can use localized there, it's okay. There's nothing wrong with it. Localized and what? Systemic. Is it clear? Is it clear? Now, under here now, you start seeing, that's where I mentioned fluconazole. Come in. Fluconazole, I also mentioned itraconazole. Am I communicating? Ketoconazole is also good for the skin one too. Are we there? Ketoconazole is also good for the one on the skin. Are we together? But fluconazole tackles both inside and what? I don't want us to go deep. Now here now when you talk of systemic candidiasis, then that's where you start talking about fluconazole again. Is here. Fluconazole is also what? Fluconazole is also what? Here you hear the fluconazole. Then here again we have amphotericin is also here. Ampho what? Tericin is also here. You also have what here? We have what? We have this one here. Pronounce it. Echino what? Echinocandins. Candins. Can what? Dins. Does it tell anything? Yeah. This is systemic now. It's systemic. Are you clear? Whether it treats most of them that treat systemic also tackles superficial. Most of them, but the one that is typical, the of them is what? Fluconazole. But there are some you may have to use. There are some superficial you may have to focus on what? You see, there are those on the skin. There are those on the finger nails. This one, I don't want to start. This itraconazole also to tackle it more. Those on the, you know that most of these Olimbo, those ones they are very very what? They are very very what? Difficult to tackle. Olimbo. Once they enter your nail, I'm sorry. Are we there? Once they enter your nail, I'm sorry. The itraconazole performs wonders there too. Please, can we stop, please? We are going into clinical. Can we stop, please? Okay, ask. They are. No, they are fluconazole. If you watch, fluconazole is the most widely used. True of us. Fluconazole is the most widely used antifungal. Fluconazole is the most widely used. That's why here you see different strengths. You see 200 milligram, you see 150 milligram, you see 50 milligram. Because of different fungal infection, they do what? They treat. Any question? What is it? Okay, why confused? Okay, you cannot hear me. Which one they don't know here? I'm sorry to say this. I'm sorry to say, but it's true. That's why I don't want to go into some things. Because if I go there, I remember I will not go today. This is actually purely clinical treatment stuff, which we have no business with. On a more serious note, the one I used to treat this one, but I was trying to explain something. I was trying to point out, even though so they have the area where they tackle more. I'm not communicating. Like now we have fingernails infection now. Itraconazole do wonders there. That's what I'm trying to point out. And I say that this fingernails, those one that this infection, fungal infection in your fingernails. You've seen the people with that, right? We call Orimbo in Igbo language. Three of us, we call it Orimbo. I say that Itraconazole do wonders there. Etra. Am I communicating? That's what I was trying to explain. Are you okay with it? Hello? Did you hear what I said now? Good. Okay, you are browsing it. But please, as you are browsing, please don't miss what I'm saying here. Okay? Please. Now, what's time? When did it? Okay, 9. I said that it's 9, I'll go, right? Good. Don't worry, 9, I'll go. Okay, now. So we have the award. Let's go to here. Let's go to here. Are we together? Let's go to here. Find out. Take it up. Okay? Find out. What is it? No, once you hear systemic, okay, now let me talk about systemic. I know that you are confused about this systemic and local, right? Once you hear systemic, it means that it goes through the blood. It has entered the system. It's inside your body. You have systemic infection inside your body. Your blood is carrying it to different parts of your body. So it's inside your system. You hear localized or superficial, what it means is that it's a particular aspect, maybe in your mouth, maybe in the vagina, maybe on the skin, a particular place. Like now, for pain, let me use pain to explain this. There are some pain you would feel on maybe on a particular place in your system. Am I communicating? You may use localized pain relief. You may rub it that place. It will go. You may rub it and still take the one you take inside. That drug will go inside the system, enter the blood, and go to the pain centers in your central nervous system and take care of the pain there. But the other one you apply on that particular spot. So localize is that it's a particular spot. Am I communicating? Now those that have, that's why, can you not understand why maybe some, I don't know why I keep using it, maybe it's because of the fungal infection we are talking about. Some women that have candidiasis, they go to the pharmacy, they give them, those that have people that in their roommate that have used it, or those that use it but they don't want to accept it yet, anyone. But the point I'm making is this, they will see, some mention clotrimazole. Who is that person? Okay, what do you know about clotrimazole? When did you come in contact with clotrimazole? Good. Now, clotrimazole. Now, clotrimazole. Now, let me use that clotrimazole to explain this whole thing now. Clotrimazole. Have you seen why I have run away from this? But I will remain there. Master, I will not be able to cover anything. But let me use it to conclude for today. Please, I don't want to be going deep next time, please, because I want to watch at the end. So you will not practice it, and you couldn't cover what you are supposed to cover. So say, what do we gain? But just learn it. Now, if you have come, that cocotimazole, we have the one that is in tablet form. Good. We have one that is in tablet form. You will insert. Then we have the one that is in cream form. You rub there. Am I communicating? Sometimes they use the applicator, feed the applicator with it and pump it inside there to have it, to come in contact with the mucosal area of the vagina where there is infection. Am I communicating? So these things are just localizing in that particular area. Sometimes the patient may be presented, sometimes the patient that has this candidiasis may come to a pharmacist or a doctor. Apart from the one they will give the patient to rub or apply there for localize that area. Sometimes they may suspect there may be some systemic undertone. They may still give the patient something like fluconazole, 150 milligrams, to take it once. You don't give such thing. They will drink it, take it once. It will enter the body, enter the system, and start acting from inside the body. That's when they suspect maybe if there's already systemic implication of that thing. That's what they will give them. Sometimes they may give to condition and won't let any systemic, both systemic and they localize to take care of which of every. They may see like me when I was still in community practice. Most of my patients that come may see as those. Some patients that this thing comes stage by stage. Some patients I'm going clinical. Some patients may come. It may not be only itching. Patient may have only itching alone. Even when I see such patients, I may just give the one they will insert, the cream. Sometimes I may just give only cream. But the patient, please, if you wash your panties, discard all your panties. Make sure that or if you don't have money to buy new panties, use pant liners each time you want to use it. And if you wash your panties, make sure that they are dry properly. Don't allow them to be damp. These things are precautions. Now, please don't have on just the one they will rub for like maybe 7 days. It will clear. But sometimes some patients may not even be. They mismanage it because the chemists after they do nonsense in chemists, they come out. The thing would have started smelling. It has graduated from just ordinary itching to smelling. Then from smelling, it may start going even to the extent of discharging purulent, some discharges are coming out. If you see different stages, in such patients, you don't just give only the one they will just rub. No. You try to come up with give fluconazole. If possible, add metronidazole, flagyl, because there are possibilities that then we got other co-infections going on there. Have you now seen different what? So that's what it means by systemic and what? Localized. Am I communicating? If what localized it may enter the system and start causing other trouble. So depending on the level of the patient, how the patient presented, you now know how to do what? Tackle the whole thing. So systemic that anything you take inside, is taking it. That's why sometimes even our lay people that did not study pharmacy or medicine, they say, hey, they say it, but they don't know what they're saying. They are describing it, but they don't know what they're describing. They're simply telling you, tackle it what? Systemically and what? Locally. Simple. That's what they are telling you. And most of these fungal infections, if I tackle fungal infection, I tackle it both systemically and locally. Some patients may come to me with all these skin issues, I don't just tackle it only locally. I tackle it both systemically. Sometimes I will give antifungal either I give what is it called again? There's one that is popular. We call it I've forgotten the name. Not Nima. What's the name? What's the name? On a 20 na sachet. What am I doing with this? Oh, it comes in 500 milligrams. What am I doing with this name? What am I doing with this name? Don't worry, if I remember it, I'll tell you. I'll give you both inside and what both the one the patient will take. I don't normally like giving ketoconazole oral. I have some reservations of that, but I give ketoconazole the one they apply on the skin, and now change to that one. If you now at least in your like 3 weeks to take care of it. Okay? So I think we'll stop here. We'll stop here so that we'll stop here. What's the name of this drug again? Flucin. You call it flucin. Fucin, sorry. That's brand name. I'm trying to remember the generic name. Fucin. You call it Fucin. That's the brand name. Fucin. Yes, Fucin. Yes. You call it what? Yes. That's the brand name. You call it Fucin. It comes in 500 milligrams. You take it one daily for like 3 weeks. Griseofulvin. Good. Grisio what? Fulvin, good. That's the name. I use it. I use it very well for most of this old one. The person will take it as tablet one day, then now apply it on the skin. It takes care of it. So I mean that is an example of systemic and what local. At least I've given you an example for candidiasis, fluconazole inside and clotrimazole outside. So these things are what we are. Hello, what are question can I say now? You should have kept me on this question for almost 30 minutes. So, I'll trace your name. If I am, I'll deal with you. All right, I think we'll stop here so that we'll do other things I have for today. I won't say it again. Ask others, they will explain to you. All right, thank you very much. Please, my attendance, class, my attendance, please. I don't like this thing you are doing. As I enter class, please, circulate the attendance, please. What is it? Griseofulvin. 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 That's the generic name. The popular brand is Fucin. All right, thank you very much. See you. See you when? Tomorrow, Shay? What is it? You don't want us to cover this course, right? It's a wild run. I think I have book again now. All right, thank you. Where's it? It is time. Okay, you are done with that. Thank you. Or can you be ever? Oh, yeah, there's something there, boy. That's not it. 8 30 minutes.